தனதந்தா சொர்க்கமே என்றாலும் அது நம்மூர போல வருமா? அட என் நாடு என்றாலும் அது நம் நாட்டு கீழாகுமா? பல தேசம் முழுதும் பேசும் மொழிகள் தமிழ் போல் இனித்திடுமா? சொர்க்கமே என்றாலும் அது நம்மூர போல வருமா?
Tuberculosis is a major public health problem in India. In 2020, India accounted for 26% of the TB global incident cases.
தம்பிக்கு வந்துருந்துச்சு. அதுக்கப்புறம் அவனே ட்ரீட்மெண்ட் பார்க்காமையே அவங்க லைஃப் அவனே பாழாங்க.
Once the patient is diagnosed with TB, the common thing they face is social marginalization of the patients, and because of the financial deprivation, they don't continue the treatment regularly.
அவன் என்ன நினச்சி அந்த மாத்திரையை போடாமல் இருந்தானோ நம்மளுக்கு தெரியாது. அந்த போய் நாங்கள் அவன் உயிர் விட்ட பிறகு செத்த பிறகு அங்கே ஆஃபீஸ் வேலை செய்யலாம். போய் பார்த்தா பேக்கிலேயே மாத்திரை வச்சுருக்கான்.
80% of the patients' first point of contact is the general practitioner or the family physician who has to do the initial diagnosis. The problem lies with the patient also, because for the first 1 week of symptoms he goes to one doctor, then the next 1 week of symptoms he goes to the next doctor. So the cumulative period of delay in treatment is attributable to many doctors.
Hi, I am Dr. M.S Krishnan, Director of REACH. REACH in its 25 years of journey has played an important role in developing, conceptualizing and implementing a private sector model for TB care in India.
நட்சத்திரா சென்டர்ல வந்து அப்புறம் நட்சத்திரா சென்டருக்கு போயிட்டு
அங்க வந்து நட்சத்திரால வந்து
நட்சத்திர ஆஸ்பத்திரி அம்பத்தூர்ல ரேவதி மேடம் இருந்தாங்க.
The REACH Nakshatra model respects a person with TB's choice to choose care either in the public sector or in the private sector. The main focus of the Nakshatra model are the Nakshatra centers housed in private hospitals across the Chennai city.
The private practitioners also came forward to provide a space in their hospitals, in their hospital premises, to function as a center for TB care services.
This project has been designed in close consultation with private practitioners, chest physicians, general practitioners, and leading TB experts.
Being a private hospital, we do get patients from the low socioeconomic class. So one is the diagnosis, the other one is the treatment. Both ways they helped us, because expert TB, the test that we do for diagnosing tuberculosis in a short duration, it's available in a few labs in Chennai, but it's very expensive.
The Gene Expert MTB assay is a cartridge-based automated test that not only detects the presence of TB bacteria, but also detects resistance to the rifampicin drug.
Ever since this Gene Expert was installed in the center, we've been seeing increasing number of patients referred by private practitioners, and a large number of patients are being benefited by this facility here.
Rapid diagnosis with the Gene Expert test therefore helps TB patients to be started on treatment as early as possible.
மாத்திரை கரெக்டாக கடைபிடிச்சா எந்த நோயும் போய்க்கலாம். அதான் முக்கியத்துவமே.
Private sector engagement models such as REACH helps in a win-win situation for all the stakeholders concerned. The public health program gets their share of notification and an understanding of how people in the private sector get care and support.
Patients receive services like counseling on drug adherence, monitoring of treatment, risk assessment and nutritional support.
Make sure you take frequent nutritious food during your treatment. After a couple of months, you will start feeling better. You will start enjoying your food more and you will gain weight. These are signs of well-being. At no point should you stop taking your medication.
I would say for sure that most of the patients who have been diagnosed as pulmonary tuberculosis have completed the course with much ease, receiving a lot of benefits, not just by taking regular drugs and close monitoring alone, but also through the add-on facilities, which they are currently enjoying.
So this is a win-win for all the stakeholders concerned.
என் பேர் சித்ரா. என்னுடைய பேர் கல்பனா. நான் ரீச்சில் கடந்த 18 வருஷமாக டிபி நண்பனாக ஒர்க் பண்ணிகிட்ருக்கேன்.
The TB Nanban play a vital role in ensuring that once a person with symptom of TB enters a Nakshatra care model, they are followed up, counseled and provided care and support.
என்ன மேடம் வர சொன்னாங்க, சப்போர்ட் குரூப் மீட்டிங்க்கு என்ன வர சொன்னாங்க.
ஒரு பேஷண்ட்டுக்கெல்லாம் மீட்டிங் எடுப்பாங்க. அவங்க கூப்பிடும்போது நல்ல 4 பேர் கூட எல்லாரும் கூட பேசி பழகி கொஞ்சம் தைரியம் வந்தது.
ட்ரீட்மெண்ட் முடித்த பிறகு திரும்பி வரும்போது அவங்க முகத்தில் அந்த சிரிப்பை பார்க்கும்போது எனக்கு ரொம்ப மகிழ்ச்சியாக இருக்குது.
This has emerged as an excellent model wherein we bridge the gap between the private practitioners, the government and the people suffering with TB. This also has increased the notification many-fold from the private sector towards a TB elimination program. So we're very happy with this model and it's been implemented across the entire Chennai corporation.
எப்படி நம்ம நோய் இல்லாமல் இருக்கும்போது எப்படி பண்ணனா அதே போல் தான் இப்போ.
The success of this private sector engagement model is a trust that private practitioners have in the system. They do not lose their people with TB. They retain their consultation fees and the TB Nanbans play a vital role and act as a bridge in supporting their people with TB, thereby increasing footfall to their clinics. The only way we can end TB in India is to successfully engage the private health sector. And the only way we can engage private sector is to have an intermediary, a support mechanism to act as a bridge between the public sector and the private sector.